Hi, I'm Dr. Akash Chaudhary. Welcome to the talk show. And today the topic of the talk show is myth about ventilators. And my host for the day is Dr. Bhavik Shah. He is the chief of our critical care unit. Welcome to the show, sir.
Thanks, Dr. Akash.
My first question is, uh, if suppose I have come with my patient and doctor says to me that your patient needs to be on ventilator. So I have to think that I'm not able to see him or her ever again.
For that, first we have to understand what is a ventilator. Basically, ventilator is an artificial lung support system. What you can say.
Okay.
So, whenever your lungs are not, the patient's lungs are not doing its function, like they are damaged, they are suffering from pneumonia, or there is water congestion in the lungs, and the lungs are not able to do their function, which basically is taking oxygen and getting carbon dioxide out. Then ventilator helps act as a support system to the lung, helps the lung in maintaining that function. So you have to understand that ventilator is an artificial support and a temporary support. It just gives rest to the lung, gives time to the lung to recover. And once the lung is recovered, that ventilator can be taken out. So putting a patient on ventilator, even it may be an 80-year guy, a 90-year guy, doesn't mean that it is the end of it all. If by medication, by antibiotics, by surgical treatment, we are able to repair the lung, the ventilator can be easily be taken out. In lots of patients of any age, we are able to take the ventilator off. So if in life you get a scenario that your patient is to be taken on ventilator, please don't be scared. It is a temporary thing, and once the problem is sorted out, your patient can be taken off ventilator. Now you can compare this with very similar to an extra tire of a bicycle. If one of your tire gets punctured, you take it out, put a stepney, repair the tire, and replace it. It is, in a simple language, similar to that. So you can be safe that if the lungs is getting repaired, your patient can be taken out of the ventilator. No need to panic from that point of view.
A very nice example of stepney. So ventilator is basically a stepney.
Yeah, it's a stepney. It's not a complete. Again, the point is it cannot take the complete function of the lung. The lung has to function a little bit. Yes, it will support the lung, give the lung to rest so that it can heal on its own or with medical support or surgical support. And once it is repaired adequately, we can take the ventilator off and have a good outcome.
For how long you can put a patient onto the ventilator?
That's a very good question because many times the lungs takes a long time to recover, particularly in elderly patient or a patient with a lot of complication. So relatives tend to panic. It has been so many days and our patient is not off ventilator. Give time. The lung takes its own time to recover. It may be 7 days, it may be 14-15 days for some cases. Some cases like COVID may take 3 to 4 weeks. So the time duration may be variable. It depends on patient to patient, response to response. But once the lungs recover, the ventilator can be taken off. Yes, there is no upper limit, but it can be for 15 days, 30 days, 60 days. But most of the time, in 2 to 3 weeks, we should be able to take the ventilator off in most of the cases.
Okay, my next question is why the patient's attendant is not allowed in the critical care unit?
This is also a point of lot of friction between patient and doctors and relatives. You have to understand that whatever we do in the ICU, everything that rules are made or that protocols are made only for the betterment of the patient. So this rule that we allow only restricted entry is for the betterment of the patient in the form if first thing the patients are critical in the ICU. Second thing, there are lots of patients are on steroids, they are immunocompromised, their immunity is down. So if we allow a lot of relatives traffic, the chance of your patient getting secondary infection, secondary complication is very high. So to prevent this infection, getting it from outside, we try to restrict relatives as much as possible. We try to make it just 1 or 2 contacts per day. And at the same time, it is not very fixed, rigid. For some cases, on case-to-case basis, we also allow, if required, multiple visits. But most of the time, we restrict visits to prevent infection.
Thank you for the nice answers and thank you for your precious time.
Thank you, doctor.
And we will meet on the next tech show with our next guest. Thank you for the day. Be safe. Thank you.